Welcome to our second training of the use of the hospital management system. Today we are going to look at how to handle a patient from the time of reporting to the hospital to the time of leaving the hospital. So we'll start by looking at reception in the menu. So when you click on reception, you'll find that we have three items. That is register patient, book patient, and admit patient. For today, we shall look at two items, that is register patient and book patient. So when a patient arrives, if he is or she is not registered, you click on register patient, and then you type the details that are shown. So like for example, for name. So as you type, you realize that this patient number is generated automatically. So the patient will be given a patient number. And then you come and enter the mobile number. You enter the email if it's available. You enter the NHIF number if available and the ID number. And then you click on the add patient to save the patient. So if a patient came and he or she has forgotten his patient number, you can use the find patient. So when you click on the find patient, it's going to give you an option to search by name. So if you enter the name of a patient, so the patient will be shown with a number. So you can be able to know whether it's that patient or not. So it will give a list and you can select from the list depending on the attributes of the patient. So once the patient has been registered, you now go and book the patient for consultancy. So this one is used to book a patient for consultancy. So what you do is you enter the patient number. So for our case, we have patient number 1. And then you enter the consultation fee, what you charge for consultation, the payment method that will be used to pay, and then you book the patient. So the patient has been booked for consultancy. So now the patient will move to the queue, and on the side of the doctor is going to use this menu item outpatient. So doctor outpatient. So the doctor will be seeing an outpatient queue. That will be a queue of patients who are in the queue. So usually the queue is in some order of first come, first served. So the doctor will click on consultancy. So this one will open the patient consultancy window. So we have things that the doctor can do. So for example, depending on the doctor can send the patient to the lab. So you'll use this, click on this lab test. So the lab test will allow the doctor to book the patient for some lab test. So the doctor will give a description of the tests that she wants or she want. So like for example, if it is maybe like, I don't know, maybe the pH level. I don't know, I'm not a doctor, I'm just using some illustration. Maybe you also want the HP level and so forth. And then from there, the doctor will click on book patient. So the patient has been booked for lab test. Now the patient will move to the laboratory. So the laboratory will use this in the menu and tests. So the laboratory will also have a queue of patients who are awaiting tests. So you'll have the queue number, the consultancy number, maybe the patient number, and the tests to be carried. So once the lab has done the tests, the lab technician will click on results, and here we'll post the results. So like for example, maybe for the first test is normal, maybe the other one is 12.4, something like that. Then maybe what is the cost? Maybe the cost is 400, payment method, maybe cash, and the patient, the lab technician will save the results. So from there now, the patient will go back to the doctor. So the doctor will still use the outpatient. And when the doctor comes to the consult, the second round, and then the doctor now will go to prescribe. So the prescribe will have the results down here. So you can see the lab test results, so pH level and maybe the HB level. So depending on the doctor, these are the results. So the doctor will give now some prescription. So for my case, I'll just use some haphazard, maybe something like this, number of days, times in a day, the quantity per dose. So let's assume it is 1 day, once in a day, and it's only 1 dose, so the total is needed is 1. So you add the drug. So the drug will be added to this list. Maybe there'll be something else that the doctor will add. Maybe for this one, be taken for 5 days, maybe 3 times in a day, so it will calculate also the date, okay? And then you add the drug, so it will be given the list. So once the doctor has completed the prescription, you move to the next patient. So when you click the next patient, the prescription now will be updated for pharmacy. So next patient. So since we don't have any other patient, this list will be open. So when the patient moves to the pharmacy, pharmacy will go to sales, and then the pharmacy will load prescription. So load prescription. So the patient will be having the consultancy number, which should have been issued maybe either by the doctor. Yeah, by the doctor. So if I entered 14 and I click load, so you can see, and then you click this. When you cancel, it clears everything. So you use this button to close. Cancel is when you want to clear the list. So you can see the list has been loaded to the prescription, and then from here now you process in the normal way. So you'll talk of the amount paid, the change, and the payment method. I think this one we had covered later. And we can say that will be the end of today's. But what you realize is that when you come to payments, you'll find that you can be able to see, like the consultancy now is there. So maybe you want to filter by date, you want to look at all, and for today's date. So when we process the filter, so you can see the payments that were carried out at the consultancy and the laboratory are all coming here. So that is it for today. How a patient can be from the time of arriving at the hospital to seeing the doctor, to going to the laboratory, to the pharmacy, and maybe leaving the hospital. So next time we shall be able to cover more.